Medical information on this site is provided as an information resource only and is not to be used or relied on for any diagnostic or treatment purposes. This information does not create any patient-physician relationship and should not be used as a substitute for professional diagnosis and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. Doctors Ruhoy and Kaufman shall have no liability for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information contained in this site.
Welcome back to Unraveled, Understanding Chronic and Complex Illness. I forget what we titled this podcast. My name is Eileen Ruhoy, and I am with
David Kaufman. Hi, welcome back.
And we have a special episode today in our patient series. We have a patient of mine, but now a patient of ours, because she has graciously agreed to be on our podcast and share her story, which is very reminiscent of lots of patient stories that both Dr. Kaufman and I have heard over the years that we've been practicing. So we are grateful, Julie, that you are here with us today to share your story and your journey and how it started, what sort of transpired over the many years, and sort of where you are today.
Sure.
So thank you for being here.
Absolutely. It's a complete honor to meet you both, and to have you in the same room. It just feels amazing. I think I was sharing with you earlier how much it's meant to me for this podcast. I've learned so much, and the compassion that you two really exude from this it's just huge for us patients. We need that. We need to feel believed and understood, and what can we do for you, instead of, yep, you've got this, keep moving on, right? So
yeah, well, we appreciate you saying that.
So thank you. Yeah. And I know a lot of patients don't have the opportunity to say that, so I'll say that for them.
Thank you.
We appreciate
we really
appreciate.
I mean, we'd like to hear those words, obviously, because it sort of gives us more, like we're doing something
insight
right.
On,
like we feel like, okay. And it's true. And story after story. I mean, I was saying just yesterday, I had a new patient, and his experience with the doctors that he had been seeing over the years was just one sort of invalidation, gaslighting after another, and he was so frustrated. It was so obvious. He was so frustrated, and some of the stories that were almost, I would argue, unbelievable in some respects. We've heard it so many times that clearly it's believable.
Yeah, for sure.
So we do appreciate you saying that.
You bet. You bet. Well, let me just jump right into my story.
Please.
So, I'm going to share my story, and hopefully it will resonate with a few of the patients out there, and obviously some doctors listening. It's probably a good idea to listen to other patients and what they've experienced. So I'll go way, way back. I was a kid with a brother who always wanted to play with me, and from a small child, I was trying to get away from him and take a nap. My mom would say, he just wants to play, and I'd be, I just want to take a nap. Well, that was a theme. My friends would come over to play, I'd want to take a nap. I can remember playing, house. I was the one that wanted to be the one taking the nap. That's kind of an odd thing, right? Looking back on it, I'm thinking there was some definite signs. I knew I just didn't feel obviously as good as everyone else, because they just kept going and moving, and I'd just be kaput. But I didn't know how to put it into words or even really say anything to my parents about it, other than I just don't think I have as much energy as most people.
Did you ever tell your parents? I mean, did you ever say, I
Yeah.
just feel tired a lot?
Yep. And I would say they could say growing pains, right?
Yeah.
And I was a gymnast, which,
Checkbox.
Exactly. And I was a very good gymnast.
Checkbox.
And of course I had no idea, but parlor tricks literally in my family was, hey, Julie can put her legs over her head.
The checkbox book?
Oh, exactly. I am.
That's the title of a book we should write, the checkbox book.
Absolutely. I'm a couple of checkboxes, I think. So here I am tumbling away. I'm a great gymnast, not realizing that could be an issue. Right.
Well, there could be a reason you're such a good gymnast.
That's right. Or that maybe I shouldn't be putting my legs over my,
right.
Didn't need to be doing so much.
Let me interrupt you a minute. It's interesting. I go through obviously a whole history with patients, and often they'll say I was fine until I got mono at 19 or COVID, right. Okay? And then I go back and I say, well, were you really fine? And we go through the whole history. And over and over and over, I will hear a person say, I was fine. I just was more tired than everyone else. I needed to take more breaks. They didn't say nap necessarily, but they just noted they would be more tired than most of the other kids. But it wasn't an illness, in quotes,
Right.
and it wasn't a disease. It just was, they were different.
They
I
noted-
usually ask, were you able to keep up with your peers?
Right.
And very often they'll say, no, I was sort of
Yeah.
the slower one. I was the more tired one. I didn't really want to do as much as my friends did.
Right.
And
It's almost like it's a prelude to what you're going to be telling us, because that, to me, that's not chronic fatigue syndrome. It's just fatigue of unknown
Just
etiology. It's
something,
Right.
something kind of underlined. We
Yes,
don't know yet,
exactly.
right? It's
like a hint.
yeah, and you only know your own experience.
exactly,
I mean,
exactly.
I'm normal, and every time I couldn't maybe push forward, even as a kid, it was kind of taught or thought to be more a choice, right? Well, you're not wanting to do it.
That and what you said just before that about I'm normal. Over and over and over, I've heard patients say, well, I thought everybody had
right.
joints
Right.
that cracked, or everybody had a stiff neck, or heard ringing in their ears.
Yeah, no, it's true. I mean, like, TMJ is a very common thing that
Right.
even people, when they were young, they said, I remember my jaw used to lock or would hurt sometimes. And they would just think that everyone's jaw must feel
Right.
this way.
Right. We only have our own experience.
Right.
Right.
And that's part of the issue we have as patients is we only have our own experience. So it's hard to know what is normal and what is. So I guess moving along with the story, the next big thing, you'll like this, was mono.
Jeez. We're running out of boxes here.
Mono and a car accident in the same year. And it was
Oh.
it was quite something.
How old were you in that
I was
year?
about 16.
Rear-ended car accident.
Yo, yeah, I was
course.
spun,
Wow.
no
Were
no
you
seatbelt.
driving?
No, my husband he wasn't at the time, but
Right.
my high school sweetheart, who's now of 33 years now.
Nice.
Oh, wow, that's great.
Very nice.
That's great.
I stayed with him even after the car wreck. He's gotten better at the driving. So that was definitely a time where I knew I'd felt horrible, and I didn't stop because I'm a teenager and I'm in love and I'm doing and I'm going and I really didn't take care of myself. So moving forward from that, I felt a little bit kind of diminished as far as how much energy I could kind of output, and I just thought, well, Julie, you just should be taking better care of yourself. So I would try, and then the next thing that happened, then I had kids really early. I was 18 with my first one, 19 with my second. So, and then 5 years later, number 3. So we had all 3 girls, and each time I had preeclampsia. If something was going to happen, it was going to happen to me, kind of a situation. But during
But
this
never
time,
eclampsia, right?
pardon?
Never eclampsia, just preeclampsia.
Yep, just lots of just bed rest, lots of mag sulfate, but just really high blood pressure. And I guess I should back up with the blood pressure. That was actually found at age 10.
Yeah. I was
So
gonna say about the blood
So
pressure. Yeah,
I,
that's
with,
another
with Eileen's
big
permission,
box.
looked at her note.
Oh,
in the
did you?
chart.
Okay, yes,
So
very
I
fascinating.
cheated, okay. And I was struck by that. I mean, was there a workup or a question? Why would
Well,
a 10-year-old have hypertension?
I went in for tubes in my ears, which happened frequently. Had lots of ear infections, and at the time, I think my mother, bless her heart, was kind of like, well, yes, I think we do have high blood pressure here, but we don't want to put it on her chart. She was really insistent that everything kind of look okay, and she didn't want me to be labeled.
Yeah.
And in some sense, I understand what she's saying, but I think they did some testing, but they didn't really do a lot of testing at that point.
And did your OB know that you had elevated blood pressure as early as age 10 when you were pregnant? So it was
Yeah,
to
I
monitor
had
a little
shared
bit more
that.
closely. I mean, obviously the preeclampsia was picked up
Yep.
consecutively 3 pregnancies. So
Yes.
so somebody
And I was kind of on and off blood pressure medicine. The interesting thing about my blood pressure is that it is extremely high when I don't feel good. It's just, I mean, it sounds like simple, makes sense, but it like shoots through the roof. That
Yeah.
bottom number is just extremely high. And no matter the medicine. And I can feel it.
That's right. That was an interesting point. So it was, if you read, it was diastolic that was
Yeah,
elevated,
that's right.
Yeah.
which is
Well,
very
it was over
interesting.
100. It was just,
Yeah.
and the top number was high, but not anything, that was pretty close to that number.
Right.
So it was interesting. So that was just something kind of, in the past. So had these babies, tried to function as a mom. Then I had started working part-time at a bank, and lo and behold, they decided to give you a free vaccine for the flu, which I thought, great, I cannot be missing work, right? I got 3 kids, I got to get to work. Well, I think this was I remember them saying it was a live virus flu vaccine. And I really didn't pay much attention, except that after that, I felt horrible. And I think I shared this with you, Dr. Ruhoy, that walking upstairs, I had never felt the same. I know now when I walk upstairs, it's not just, oh, go upstairs and get something. It's, I just walked up a flight of stairs. I got to take a minute, right? I got to gather myself. So anyway, that kind of set out this search for, okay, now I've never really had a lot of energy. So what else could be going on now that I've had this vaccine? Something's turned. It feels different. So lots of testing. I went rheumatologists, endocrinologists, autoimmune. Lots of test results were off. Lots of hormones were off. Lots of viruses. Nothing that was, here's lupus or here's, something that we could kind of target and take care of. It was a lot of, this is chronic fatigue syndrome, this is fibromyalgia, this is what you just have to live
So
with.
they were already diagnosing that then?
Yep. That I got diagnosed right after this flu vaccine.
And what year was that?
That was 98 or 99.
Mm-hmm.
And I went down to Virginia Mason because I thought, well, you can't just go to your regular doctor. I can't just go to a rheumatologist, which you needed a rheumatologist to diagnose fibromyalgia, I believe. I'm not sure if that's
Right.
that's true still.
Well, you don't need it, but that's
But
who was
that's kind of
diagnosing,
was so back in at this time there literally was 4 books out. Dr. Teitelbaum's, which is what I just devoured. Still do some of that to this day. But there really wasn't much out there.
Right.
And so I did everything I could. I'm kind of a researcher. I'm going to figure this out. I've got to feel better. I just knew this wasn't right. So after lots of doctors and lots of doctor visits that I left with tears, and tears, you feel like you're trying to be as honest as you can, but there's something about, I look good, I sound good, I'm all together. So that always went against me
Yeah.
because I didn't walk in there and collapse on the floor.
Right, exactly.
And the hard part about all this is that I was taught to be that way. And we all are, and to some degree, we're taught to be kind humans and, make sure somebody's not, you're not supposed to just sit in the corner and complain. And so that was kind of, quite frankly, just going against me. The one doctor appointment that I had that I'm going to share that just, I even shake my head that this happened to me. I mean, it's kind of like a dream. This is at my regular family physician's, and it was a different doctor that I normally see, but I'd seen him before. And I was having a lot of anxiety. Well, they had put me on some medication, and the guy said to me, I said, but, my blood pressure's so high. I really think there's something going on. And I had felt so weird that whole day. And he said, this is anxiety, and it's nothing else but anxiety. And I just was not sure of that. And I said, really, can we check my blood pressure? Could we do an EKG? I mean, these are easy things to do in the office. And he says, no. He says, I want you to run around the clinic. Here, I'll put a pulse ox on your finger.
Run around the clinic?
I had
You
to
mean
run.
literally?
Literally.
He literally had you run around the
He literally had me run around the clinic, around the doctor's office. I was crying. What? In the middle of the day. I mean, this isn't like there's no one there. So I'm running with my pulse ox, and I'm running. What are you supposed to do? And I get back, and he's at the door like this with his arms, sorry, I say he, but it just was, arms across the chest. And he says to me, you see, it's not a heart problem. You're still running. It's an anxiety issue. So that kind of sums up how doctors dealt with me. And I will tell you, I'd never had anxiety before. I had anxiety because I was at the doctor's office.
Right. That creates anxiety for sure.
It really does.
That's shocking.
It
Reminds me of
doesn't
like when I
even
go buy
seem-
running shoes, they make me run around.
Yeah, like do your shoes fit? Right.
Exactly.
It was like a dream. Like this could not have happened. Right. This isn't real. And it was, sure enough, there's nothing wrong with your heart. You made it. And I just thought I never saw him again for obvious reasons. Let me move forward on my story here. Got a little stop.
No, that's an important. I mean,
piece of it.
these
You
are.
know, it's the another version of what we hear all the time, which is, well, your labs are normal. There's nothing wrong.
all the time.
You know.
And I think some patients, having had that experience so often, end up deciding that somehow if they present more sickly,
Yes.
which is not in their favor either,
Right.
right?
No.
Because when everything comes back normal, then doctors sort of form a judgment about them because they're,
Yeah.
and I don't even think they're doing it consciously. Like sometimes, there are certain neuro exam components where if it's real or not, right? There are things that a patient can't fake, even though
Yeah.
sometimes they could be trying. And I know that sometimes patients will do that, but neurologists can pick up on it, and it changes the neurologist's perspective of the patient, which is a really bad thing. I've come to realize it's just because these patients are so used to being gaslit that they're trying to
They're
prove
cautious.
something to the doctor. Like, no, something is really wrong and I'm going to show you.
Right.
Right. But there are some things you
I see
can't
what you're
fake
saying.
on exam. And so, and that's a concern of mine, is that patients go in trying to almost act sick when they, and not that they don't feel it, but because doctors aren't believing them, they act in a way that's not really them. And then they try to do things on exam that, again, a neurologist can pick up on, and that will change the perspective and the judgment of the neurologist on the patient or another specialist, So, and that's my concern. It really, it's not, it shouldn't be the burden of the patient to prove to the doctor that
Correct.
something is wrong.
Of course.
Right? The doctor just needs to believe that something is wrong because the patient says so. Like when you were saying something's really wrong, that's all that doctor should have needed to hear.
Right. But that is not the case.
No,
you
he
have
made
to
you run around
you
the
have to
clinic.
say there's something wrong, and then there needs to be proof in order to do anything
Right.
to really help you. But I was me and my research. I went and found the Fiber and Fatigue Clinic, which Dr. Teitelbaum had opened. There was one in Seattle, in Bellevue. So I had done that for a while. And with that, and then my regular doctor, somehow I was in so much pain that I ended up on medication that is unbelievable, to be honest. I was on the fentanyl patch. This is all at the same
What
time.
was your pain? Where was your pain?
Everywhere. At that point, it was everywhere. It just felt like I had the flu. It just felt achy and just hurt. I just hurt. What I was learning was the medication every 6 weeks I would hurt more, because you need more and you need more and you need more.
Mm-hmm.
So at that point, I was on a patch. I was changing every 2 days, not 3. I was taking Dilaudid. I was taking Vicodin. I was taking Klonopin. I was taking Xanax. I was taking Ambien. I was taking, Provigil. You name it, I was on it.
Which doctors were doing this? Which
There
kind
was
of doctors?
there was a family type doctors were prescribing that. So
Wow.
mhm.
Did they start with sort of lesser pain medications first? I'm assuming yes, right?
Yep.
But it wasn't doing the job. It wasn't controlling your pain. So they just escalated up to the opiates.
And this was before all of the opioid,
Yeah.
contracts that were
Yeah.
needed.
Oh my
and
God, now
the-
it's a crazy.
right?
Yeah, I mean, I really actually feel badly for patients with chronic pain.
Yeah.
Oh, it's
They
terrible.
can't get
Yeah.
anything.
Terrible.
But the opposite kind of happened to me. I ended up getting too much. And I was really unfunctionable. I was upping this dose. So here I am now in complete pain, more pain I've ever been in, feeling so down, depressed, not functioning, not working, barely getting out of bed. And where do you go? Who do you go to? Because my family doctor was prescribing it, and that's how I was getting out of pain, was getting more and more.
Right.
So I had actually had a family member say, I think you need to go to rehab. And I just bawled, and I said, what? What? I have to go to rehab now? You can't send a chronic pain patient into rehab I just thought there's just no way.
Yeah.
So I had found a natural clinic over in Toronto, Canada, and I actually managed to get off all of these drugs through a CES machine and
Right.
amino acid drinks. And I would lay down 4 times a day for an hour, and I would put this on, I'd drink my drinks, and sure enough, after a few months, I was off all the big stuff. And boy, did I realize that caused pain. Different type of pain, but it was definitely causing a lot more pain than I'd ever had. So swore that off. So
Wait, what? I'm sorry. What was causing more pain?
the drugs. So
increasing
the more
doses of the narcotic.
the more
Oh, I see
pain
what you're
medication
saying.
I was going
Right.
on,
Right.
the more pain I was in,
Yeah,
but
it's
not
like
knowing that.
overuse pain. Yeah.
Yeah, but
A
you
lot
just
of
know you're.
migraineurs. Do you have migraines?
Yeah.
Yeah. So a lot of migraineurs actually have that kind of issue. It's called overuse pain. I'm sure there's fancier terms for it, but
I
that's
mean,
what.
it felt literally
Yeah.
like I don't think there was enough pain
right.
medicine to ever cover it. That's kind of
Right,
what
and
it
it would have
felt
just
like.
gotten worse had you not gotten off of them. So that was good.
But what does somebody do here? You're stuck, and they want you to go to a rehab, and you're just okay. I can't even function, and anyhow. So moving forward from that, excuse me. So during this time, I get off my pain medicine, and I had tried to go back to work, and I'd worked part time a few times over the course of these 20 years probably, and it was not happening. Even worked as a maternity home counselor, which I just loved. It was just the best job ever. I got to work with teens who were pregnant, and I got to help them take care of their babies and it was just such a cool job, and I had to give that up. And when I gave that up, I said,
You had
this
to
is
give it up because of the fatigue.
because of the fatigue, the pain and the fatigue. There was no way I could do both. I couldn't do anything. I could go to work and that was it, and I'd go home. And this was just a part-time job,
Right.
but I had 3 kids at home. So when I gave that up, I decided I was going to fight for Social Security disability. I thought, I put into it. I'll just go. Let's just try it. And when I went in that, I
So
thought
it wasn't bad enough you were overdosed on narcotics.
wasn't bad
It
enough
wasn't
on
you
that.
had to
I thought
decide to fight Social
and in
Security.
my my little brain, I thought, well, surely they're going to see that I need this, and it's just going to be well, that was not the case. 13 years later, sued the Social Security Department twice, had 3 hearings, two or 3 different judges, I believe, and still would have been now probably in the fight still. I think I even shared with you, this was I only ever worked part-time, but I was at a point where when and if this ever went through, it was up to $150,000 that they owed me. So here I am, a non-working mom at home, trying to take care of kids, pulling money out of my mortgage to take care of $1,200 a month for fentanyl patches, because that racks up your insurance. You have a max of your prescriptions. So anyhow, so that's all, nightmare. And so I thought, I got to keep in this. I got to, keep doing it. And this was literally every time I would get a denial letter, it was the most shocking and gut-wrenching thing I'd ever experienced. The judges, the things that they would say about me, I had no idea where they even came up with that. I mean, on my worst day, somebody would never say that about me. And basically it was that I was making this up, that my story was not actually my story. And I'm too honest, right? Because I look good and I can fake it and so I looked fine. I still know I did the right thing. I would have never, I should have gone in there with a neck brace and a cane if I really wanted to get it, to be honest.
Because I told you there have been
But I don't know.
There have been certain circumstances where patients have been photographed. I
yes.
remember sharing with you one
Yes.
story of a patient that I had who she was photographed at the park with her son, and so disability was denied because how could you be sick if you can go to the park with your son?
Right. That's routine, by the way.
It's
Not so much for
it's
Social
so-
Security, but for private disability. They
Yeah, this is a
routinely
private disability,
secretly
you're right.
videotape you.
it is unbelievable and such an invasion of their privacy. Like, could you imagine people in the bushes just taking pictures of things that you do on a daily basis?
I can't.
It's
But I
don't know.
also, as the patient, I also see the side, and I think it's important to note that I look okay to everyone that doesn't know there's anything wrong.
Right.
I can present perfectly. And so I do have to know, I do understand that people really don't get it. So just by me saying I'm feeling terrible.
I think you're being too kind. No, I'm serious, because I could have a heart attack and still look fine.
Right.
Yeah.
I could have had a heart attack 3 weeks ago and I would look fine.
I have
But,
tumors sitting in my
But
head.
I would have trouble climbing stairs, so I'd want to get disability. And, but because you had a nice, neat, packaged medical diagnosis, sure, disability granted. So I hear what you're saying,
Yeah.
but that's not an acceptable reason. And I spend not a lot of time, but feels like a lot of time, reading the independent medical examiner
Mhm.
report so I can write a rebuttal for my patients, and they are beyond outrageous. That's
It's
Oh,
that's gaslighting memorialized in writing.
It's
and
offensive
It's
when you read
mind-boggling.
these.
it really they personally will attack you. I mean,
Yes.
it,
Well,
I know.
so it's offensive in many respects. First of all, it's absolutely insulting to the patient.
yes,
And the doctor.
Well, I was going to get there.
yes,
And then and then it's almost like as if we're chopped liver.
Right.
Like, so what I said and what I submitted is what, just garbage? I'm making this up too. So the patient and I are in cahoots.
Right.
I
and we're
did have
just
3
lying.
doctors that had notes that had the
Right.
RFCs.
Yeah.
Well, I did the research to find out what I needed. The judge asked me, "Did you give him the form?" I did. Then he said, "I won't have anything to do with it then," because I suddenly
Right.
because I gave him the form. So it's just you're trying to do the right thing as the patient and say, "I'm just trying to get more information, so that I can prove to you," but yet that looks like I'm manipulating the system. I mean, it's just the more we try to help ourselves, the worse it sometimes gets.
Yeah.
So 13 years, I decided that was for the birds. I was done, and I became a coach. I studied to become a fibromyalgia coach. I found somebody doing this, and she was great. And I thought, yeah, I could help people. I can talk to people. I'm home all day. I can talk to people on Zoom, sure. And this was during the pandemic. Had
Yeah.
extra time, so that I loved. Did that in like 2021. And I thought, this is a job I could really do until I got COVID for the 3rd time. I went to New York for a trip and came home with COVID. And the first 2 times I had it was no big deal. The 3rd was a little more extreme.
Did you get COVID vaccines and not
I did
have
not.
a reaction? You
I did
didn't
not
because
get a
of the
vaccine.
flu
Yeah,
vaccine.
because
Okay.
I'm scared to death of any
I
vaccine.
just wanted to check.
Not that they're not good, and I
No, I
believe people
understand.
should have vaccines. That's not just for me personally. So anyhow, so I'd gotten COVID. Of course, you don't know when you have COVID if you have long COVID. Tell you it's been a long time, and it just didn't go away. And here I was having all these things that I had before. I had all the dizziness, all the POTS symptoms, all of these EDS, all these symptoms that I've known about, but I just chalked them up to chronic fatigue syndrome because that's what I had, or fibromyalgia. Those 2 things, they just threw everything in the bucket, and that's what you have. And I fought for so many years trying to tell them I had something else that I was useless. And I'd even gone to the Mayo Clinic in 2012, and they'd said, Julie, it's just chronic fatigue. Do you want to go to some more,
Cognitive behavioral therapy.
Yep. And I thought, I can't do any more. I pretty much could lead them. I know I can because I've been doing them. So anyway, during that time, I just kind of didn't get better. Things were starting to not feel right. And here I found myself was doing the best that I'd been doing in a very long time to now doing the worst I had been doing in a really long time. And then I found you guys, and I heard this. What, autoimmune from a post-viral illness? It could, and this was my thought all along, was like, in my puny brain, I got this, vaccine, and it did something inside, and it turned my immune system, and it didn't get it so bad that I got something, but it turned it, and it caused all these symptoms. That's kind of in my brain.
Okay.
Well, apparently that is kind of what happened. And so here I'm learning about EDS, and I'm learning about all the MCAS. All of this is brand new to me, and I'm just soaking it all in. And I'm going, I think they're talking about me. I think these are the boxes I've got. And what a relief, to be honest. I thought I was all alone in the world, this rare patient, and quite frankly, I'm kind of your poster child for it. I think I've got all the little.
You've got the whole
I
septat.
got the whole thing.
Or whatever the dectat. What did we decide? The pentad? No. That's
Well, the septad's the wrong word, it turns out.
right. That's what we
but
learned.
it's
The
too late
septad's
to
the wrong
change.
word.
Supposed to be octab or something. No, not 8,
No.
6 or 7.
It's 7. Wait a
There,
minute.
there's there, yeah. Anyway, yes, I think it should be revolving because there are
Yeah.
those revolving
Right.
things
Oh,
as
yeah,
well,
yeah.
right?
And actually, each diagnosis even has its own
Yeah.
associations
Oh, it's
of
like
other things.
branches.
Right. So there's
It's it's kind of just the whole thing, but not understanding how one kind of leads to another, and how this hypermobility piece,
yeah.
was really a big part. And
Yeah.
even learning, Jen Bray's story and how all of that, I just thought, oh my goodness, maybe I have CCI. And at first you think maybe I'm just being a little bit, dramatic, but no, I have to tell myself, no, this is actually how you feel. And this is where, you were saying, I was saying about people don't understand. And as patients, it's so hard to question. We do this. We question ourselves. What is the symptom that I'm having? How bad is it? Is this something that needs to go to the doctor? Is this something that somebody else just normally has and I don't need to say anything? Or is it something that I should raise my hand and say, look, there's something major going on here? And for the first time, now that I've seen you, I feel like I have that third piece of when I have something going on, it's actually might be a sign, not just like just throw it in the wastebasket to the chronic fatigue or the stuff that you said you thought you had. Now I feel like they might actually, the symptoms actually are relating to an issue, which is what
it's
we
an
knew along.
Important point, though, also that the symptoms, when you say, well, is that something important or not, those symptoms often help us,
yes.
physicians, to figure out more of the story.
And
it
we
may
love
seem
to tell you.
unrelated, and maybe, patient, I'll use tinnitus, ringing in the ears as an example. That's not something patients will often immediately tell you.
Right.
But if they do tell you, it opens up another door. It's I'm trying to think of that quiz show with the doors. It's like each of these things opens up a door to help us with diagnostic thinking.
As a patient, we know it opens the doors, and we've seen that, though. This is a bit of a scary as a patient. They're in front of the computer, and suddenly you mention something else, and you can see that door opening, and they're typing away, and you're like, wait, but don't forget what I just said. Like you're not really sure as a patient how much to share because us as patients walk in there and we just want one problem solved because we're afraid if we give you 5 problems, then none of them will be solved. Does that make
That's an
sense?
interesting perspective,
Yeah.
actually.
I always walked in there with, I need my fatigue and pain. And I've had stomach issues all my whole life. My doctor doesn't even know about it because I don't have that.
Right.
I have pain and fatigue that are way more important to me than all the 20 other
Right.
things
So
wrong.
we do it. That's why we ask a lot of questions.
I was
I
just
think.
gonna
Yes,
say.
yes.
But I will say that sometimes I will, just because I want to try to sort of figure out what I do next, I will sometimes say, what are the most prominent concerns?
Yep,
And
which
that's
is
just so
good.
I can focus in on something to start to help while we do a workup. Like that's how I see it.
Right.
But I also do not dismiss all the, in fact, I put it all in my notes.
Yep.
And sometimes when I see the patient again, I go back to the note and all the other symptoms that I was told about. And I ask how those are.
Yep.
Because sometimes if one of those symptoms has worsened since the last time I had seen that patient, that's a clue as to maybe something else that I need to think about, look into, or treat.
Well,
So,
yeah.
it's and I always say this, like, Rome wasn't built in a day, right? And I tell patients this all the time. So the first visit is really just like, I need to understand what's going on. And I just sort of start with my workup. And then I often will say, let's just start with these meds just to sort of start to hopefully give you some relief, in the next couple of weeks. But I don't forget everything that the patient has told me or like everything that I'm thinking about. So, but it's hard to convey all of that, and I wonder now, hearing you say, having said that, like, do patients walk away thinking like, do they remember that I also have this going on?
I think it's very different. I
I
don't think
think-
that's the issue at all.
Okay.
I mean, I think what you're describing, it's interesting to hear the
We've had
patient's
that
perspective,
experience.
but patients shouldn't be blamed for doing what you just described. It's the healthcare system
Yeah.
because
Yes.
you know either intuitively or overtly that if you walk in there and say, all right, I have 9 things I need to describe, right away that doctor's going to shut down.
Yeah.
Because he or she only has 10 minutes to see you, maybe 20 if you're lucky.
Mhm.
And they don't want to hear about 9 problems.
Mhm.
They will, theoretically they do a so-called review of systems, which is literally every system in the body. That is utter BS.
Bullshit.
Thank you. You know, it's such bullshit that nowadays, and even
Everything's-
25 years ago,
Yeah.
you don't even ask. You just give them some form to fill out, and then they never look at it.
They never look
You
at
don't
it, and it's
ask.
such a. You even see in the computerized charts what that patients will
Yeah, it's
send
copy-paste.
their review of symptoms. Like it's just there's clearly like a bunch of positives.
Right.
And
Which
has
is why
anyone
I don't-
acknowledged any of this?
Right,
Like
which is why I don't use those forms.
I never use
And,
those forms.
You know, I
ask
know
questions.
other doctors like us who do use them, and I guess they get something out of it. I find it interferes with taking a good history and story.
Right. I completely agree.
Well, it is so rewarding to work with a doctor that you know is going to think about you or think about your story
Yeah.
or in context, because we've been part of the system that's a 10-minute system.
Right.
And
Yeah, and part of that is not the doc. I mean, well, none of that is the doctor's fault. The problem is that some doctors change their thinking and their mode of practice because of that system.
Exactly.
And so I try to have compassion for that because we both used to work in those
Yeah.
systems. But it's
And
hard.
people have to
it's
work
not
in
the
that-
patient's interest.
Yeah.
You know. Yeah.
it's hard. But to go into a doctor's office and tell them 5 things wrong with you, you will get the look.
Yeah.
and you won't get help.
Right.
So during all this, I was feeling horrible, and my blood pressure was through the roof. And so at one point, I'd gone to my doctor, and I said, "Can you just do a blood pressure reading? Because maybe it's my cuff reading. I've got 2 at home." And of course, it was a nurse, and she says, "You need to go to the ER right now. Right now." And I think I'm okay. If I just go lay down, I've got some meds at home. And oh no, you go. Of course. So I go to the ER. Well, that just landed me drugs, which was fine, but they're just IV drugs, and then my blood pressure goes down, and then they send me home. And so then I asked my regular doctor, "Do you think I should see a cardiologist?"
You mean you hadn't seen a cardiologist? all
I
these
had
years?
about
I didn't
15 years ago. Yeah. Because cardiologists don't really, they haven't really made a big effort.
Right.
I've already had an echocardiogram. I did have some of these things worked up, but nothing really showed anything. So here I'm at the hospital, and I go home and I ask the doctor, "So shall I see a cardiologist?" And he says, "Well, if you want to." Okay, so I do that because you can self-refer, and I go into, of course, you're self-referred, which again can be an issue. But I went to a great cardiologist, and he is a great cardiologist. He did not believe me that there might be something else wrong, nor did he believe my blood pressure readings because my cuffs were way off apparently. So you just have, I mean, it's really hard when you're being told that you're being untruthful. And I had no intention of what is the point of me going to a doctor and lying about my blood pressure being high?
Right.
I just really didn't understand. I kind of felt like
Or
I had
maybe
to
you're
prove
addicted to blood
myself.
pressure drugs.
Yeah, I'm
Drug
addicted.
seeking.
I'm addicted
She's
to
drug
those beta
seeking,
blockers.
Carvedilol.
I like those ones that knock me out completely and can't think. So I left that appointment with. He says, "Well, go see your regular doctor. There's nothing I can do for you." And I had an echocardiogram, and nothing's great, but nothing's terribly wrong. So now I'm going to fast forward a little bit into I found, so as I'm listening to you too during all this, I found a naturopath who I found her through the EDS online, which is, if someone needs a doctor, go to the EDS online website, and they have
EDS
physicians.
Society.
Yep, you're on there.
Yeah.
And she was on there. So what do? Reach out. Immediately got an appointment. She even took insurance. She gave me an hour. I mean, I was in tears. I thought, this is great. She was exactly who I needed. And I said the word septat, and I said your name and your name. And oh, she says, "I share patients with Dr. Kaufman. I know exactly." And I said, "You know what I'm talking about?" So I just felt like I found my person. And so she has helped me probably, it's been a year. And she got me the upright MRI. Everything that I would listen to, and I would think, "Oh, I think I need NeuroQuant now." She'd be like, "Well, I don't even know what that is." And I said, "Well, I'll look it up. Don't you worry." So I have all these testing because I've listened to you two and decided what I needed. And she was kind enough to order them. I mean, really, her words are like, "Is it going to make you feel better? And are we going to, if you think it's going to get to the bottom of it, let's do it." And I never had anybody say that to me. Might get teary here.
That's
Yeah.
amazing.
She says, let's check your renal veins. Let's do an ultrasound. You've got blood pressure issues you've had since you were 10. So sure enough, blood pressure, is high, but I'm in there and she's checking it. And they found what's called fibromuscular dysplasia, which is a beating of the arteries, and you think it possibly could be connective tissue disorder. We think it might
yeah.
be genetic.
I just have to interrupt and
Yes,
say,
please do.
that even with all the criticisms I have of the system and all the gaslighting and PTSD that gets created, nevertheless, it is and was, when I read your story, mind-boggling to me that a person who had blood pressure at 10 years old had never been worked up for renal artery disease or renal vein disease. Mind-boggling, and you're saying, because that's a standard of care kind of thing.
2012, I had an ultrasound of my renal arteries,
Right.
which I had copies of because I had my stack, and there was nothing. And in fact, when I found out that I had this, I sent to my normal doctor. I says, hey, I think we might have come up with the reason for this blood pressure. And I said, I think it's this. They found this beating. And he says, I doubt it. And he says, in 2012, it wasn't there. And I said, well, the difference would be this. 10 minutes. I remember that appointment. It was 10 minutes long.
Yeah, it's a technique.
45 minutes. And this gal already asked me about the bifurcation of your aorta. And, she knew things that she was very knowledgeable and knew what she was looking for.
I think the point I'm trying to make is in the regular world of medicine where we are trained in certain ways, it's at least in internal medicine, I'll speak for myself, it would have been a reflex reaction for me, and I think most internists who are reasonably well trained and reasonably good, to look for a cause of hypertension when it presents in an unusual situation the way it did for you, and not give up after one 10-minute thing. So I'm just remarking that I think what happens is even that basic approach to medicine gets completely screwed up and lost when the person has some other problems and the doctor just goes, can't deal with it.
And in because I'm not a doctor, in my brain I thought I needed a cardiologist because I have a family history. My grandparents both died, one at 46 and one at 41. My grandmother and my grandfather.
Right, that's what I remember.
And
that
they both
part
had
of your story, and I thought, how was she not worked up the wazoo?
Major heart attacks and rheumatic disease, and the whole side of the family there was familial issues. And my dad had a heart attack at 54, and at 75 he's had a double bypass. And so I'm thinking, I've had high blood pressure all this time. Somebody must want to do something.
Right.
But nope. So finding out that this was fibromuscular dysplasia, then that's when I'm doing the research and I'm figuring it out. And well, it's the thing to have, because they have a fantastic organization that is run by a nurse called, I think her name is Pam Mace, and she had it 20 years ago. And anyway, great organization, and I've learned so much. And something I want patients to hear, and even doctors, is basically anyone, and it's about this age, about 50, where people will have this spike in the blood pressure. I was having the whoosh, not the tinnitus, more than just the whooshing
sound,
whoosh, whoosh.
Pulsatile tinnitus.
Yep, which is your carotid right into your eardrum, and I get very shaky inside. And I thought it was anxiety, but I really do think it's it's all this beating, I think, in there, and headaches. Headaches were probably, I was having a migraine almost every night at 3 o'clock in the morning. I would wake up and have to sit upright. And I was taking, I had Imitrex, I had sumatriptan, and I had Maxalt. And I know you can't take them together, so I was taking them one day one day the other. Then I learned that you're not supposed to take those when you have fibromuscular dysplasia.
Right.
And it explained, though, to me, I had notes everywhere about my symptoms. And I wrote down, triptans make me hurt. They physically made me hurt. And I thought maybe one doctor would like to know that. I don't know. But I thought, well, of course it does, because it's your arteries, and that's, right? Aren't they?
They're constrictors, yeah.
Yeah, constricting it.
Which is not good when you have fibromuscular
No,
dysplasia.
so you could not take those. So here I'm at a situation, though, that now I can't take them. I know I'm having some brain problems. I'd had some MRIs and found out, small vessel disease, white matter, all these things. And my doctor, she's great, she's a naturopath, but I needed a neurologist. And my neurologist wait was about a year out in my town. And all I could think of was, I need Dr. Ruhoy. Like no doctor is going to understand what is happening. And I literally even, I would have gone to 4 or 5 doctors before I even would have got just a tad of what you gave me. I mean, and I mean that because you have the background already. I don't have to explain and convince you of my symptoms.
Well, I think a key.
She was
difference here.
complimenting me. Don't interrupt her.
I'm going to
No,
compliment you
I'm
too.
just
I'll
joking.
give you another one
That's
later.
how-
Don't you worry. I got lots.
A key point or a key difference here is if you had gone to another neurologist, neurologist, and said, I'm whatever age you are, and I have white matter disease in my head, what's wrong with me? That is all they would have looked at, your
Yes.
head and your white matter disease. They would not have looked at the larger context of the
Correct.
entire you and your illness, and that's the difference.
Yep.
That's a pretty good compliment.
It's okay.
It is.
I mean, no other neurologist is going to look at me the way you did when I said, I used a glucometer to check my nose stuff, right? Like, that's normal, right? Other neurologists is going to be like, what? Yeah, I just wanted to see if I had a, IIH up there. So,
Aye, what?
I,
Aye.
I. That's how we feel. So, where am I? Okay.
Neurologist.
I was giving you compliments.
And I interrupted to give what I thought was a good compliment.
So really, but what does what does a patient do when I knew she was probably the only doctor besides you, but here I need a neurologist,
Yeah.
and your brain is a big deal, and I have 9 grandchildren. I love looking at people when I say 9, and they're like, "What? Crazy!"
I know, you're
And
so young.
one of them is
to have
9,
9
and the
grandchildren.
rest
Well,
are
she
under
had them at
5.
18
No, I
and
know. She
19.
started young.
I did start young. But I want to be around for them, and I love my life because I get to live any way I want outside my home.
Right.
And when I'm home, it's my respite, and I get to take care of me. I've learned a really good life. I'd like more of it.
Yeah.
And I honestly think it's possible, which I think some patients get to the point where they just are, this is the best it's ever going to be, and they kind of stop.
Yes, that is true. I mean, I think one of the things that we like to infuse in patients is some hope because
Yeah.
so many become hopeless.
Yep.
Because they've only gotten worse over time and they haven't been able to find someone, forget about helping them, just even believe them, right? Which
100%.
sometimes is half the equation. Just to know that a doctor believes you and a doctor is thinking about you and a doctor wants to help. They just come with so little hope. And there is hope, and we very regularly say that.
Yes.
There is hope, and sometimes it takes a lot of trial and error of stuff to figure out what is the best regimen for a particular patient, but there is always an answer. There is always an answer.
And the thing that I liked about when I was coaching was they were all patients that had been dealing with doctor issues. I mean, we all have doctor issues. And they didn't have anyone in their corner. They really have not. And I noticed that all I had to do was reach out across Zoom, not even in the same room with them. And the amount of healing that could take place just because I'm offering to listen and help. I don't have any answers, but I can help, right?
Right. No, I think that serves a good role,
everything.
though.
It's everything.
Yeah, absolutely. 100% agree. I think that that kind of work, to be honest, from like patient advocacy and even just sort of, what they coaches or I don't know, there's like different, I think.
I don't even know what it's called, like advocacy work or
I think it's important because you fill in gaps,
Yes.
I mean, there's just so much that doctors like myself and Dr. Kaufman, and again, we very, very regularly give credit to the fact that there are hundreds of other doctors who do what we do. We're part of this large group. So it's not just us, but regardless, it's not enough doctors for sure.
Correct.
And even us can't do it all. And so I think the kind of work that advocacy workers do is to sort of fill in those gaps for patients, right? Just to give them support in the interim, to listen to them in the interim, even sometimes provide additional information. I have some patients who have what they refer to as their health coach, but I don't know exactly what that means. But these health
probably very
coaches
similar.
will research something for them
Yes.
actually and find out some answers about a particular symptom or diagnosis, or maybe even something that I had said that I just didn't explain well enough in the appointment, which I fully admit sometimes that I think I'm explaining it well, but clearly I'm not always. So I think that it's nice that there are these kinds of people who are taking on this kind of work to help chronic patients, because it really does help. It seems to, at least for me and my patients, it, like I said, fills in those gaps of
Yeah.
what, the time limitations that even we have. And
That's
despite the
exactly
fact that
right.
we are not limited to the 20-minute visit, even in the 2-hour visit, there's only so much you could still
There's only so
accomplish, right?
much.
So I think that work that you do is important, I guess.
Do you
is
do
what I'm
that as
saying.
part of an organization? Or?
So I was for a while, and I had to give it up when my brain was just not able to keep up. And so after long COVID, I kind of gave it up. And to be honest, I want to do that work. I love it, but I want to do it with this community because I get it now. Like I'm
Yeah.
learning so much, and a lot of the patients. I'm one subset of researchers, and I'm going to figure it out, and I'm going to find a doctor, and I'm going to go and do. And you've got some that don't maybe have that skill set. They've got other skills, and so they don't know who to call, who to go
Yes.
to, what to research,
Yeah.
what drug to even ask for if they're because doctors are sometimes willing to help. If they say, bring me, my doctor was willing to, if you bring me, some ideas, I could kind of prescribe myself.
Yeah.
And so getting that information to people that can't see you, right, is important. And I don't know what that looks like in the future, but for me to get better, I kind of went through this year of I had to be really, really silent to figure out, do I have really something wrong? Because I've heard from others that it's just push yourself, Julie, just keep going and
Yeah.
keep doing. You're going to be fine. No, I'm not going to be fine. I needed to listen. I needed
Right.
to stop and take care of me.
Yeah.
And so I have to be the patient first. I'm learning to be the
Mm-hmm.
patient first, but I jumped on that other side of helping people. And it's really easy to get into helping people
That's
and to
great.
leave yourself behind.
Yeah.
It's really
You have
an
to
easy
find the
thing to do.
balance. I mean,
You do.
helping other people, that's, people call it an antidepressant because it really does
is.
make you feel good to know that you're sort of giving to others and to the
Yep.
world at large. And I think there's something to be said for that, even with regards to mental health, right? To
Yep.
know you're helping others
Yeah.
can really be like a boost to your own mental health.
Yep.
And, and I always say that I think patients are the perfect people to be patient advocates
Yeah.
because you've experienced it. It's real world experience,
Yep.
and you're very articulate and very kind,
Oh,
and
thank you.
you're very
Well,
and it's
compliments
true.
on this side. I like it. Okay. Yes.
So I think that you have a lot of qualities that I can see where you would be a great patient advocate and a great patient support person. But you're
it's-
right, you have to balance it with also taking care of
You do.
yourself.
It's so much information you're learning and taking in about you. It
Mm-hmm.
feels a little selfish. And and that's okay to be, but to know that I can use this for others,
Yeah.
it helps in somehow just make you not feel so just downtrodden with your own illness. I mean, you just kind of
Well,
get
I think some of the best advocacy, and I'm going to do this in health in physicians also, are those people who have an illness and then start an organization like
Yeah.
the fibro
yeah,
organization you mentioned.
exactly.
The patient or family members say, wait a minute, there's not enough out there, and they start an organization, and that has made huge changes. I mean, look at Dysautonomia International. I just blanked on her first name, but her daughter had POTS, and she couldn't get anywhere, and look what she's done.
Yeah, it's
It's
amazing.
unbelievable.
She's a lawyer, I
Right?
think, though, so she had some
I think so, yeah.
contacts and
And
resources.
then the other but the other point to make is, with some small exceptions, when I marvel at every meeting I go to or every time I'm talking to a bunch of doctors, that the doctors who do what we do, they're doing it almost literally 95% of the time because either they or a family member have these problems and they finally figured it out and said, wait a minute, this is
Yeah.
real. I'm going to do this work. I just remember sitting at a DI meeting, going around the table, there must have been 25 people there. I mean, I hate to say this, I was the only person who didn't have a personal story or family member with these illnesses
Yeah.
that got me into doing this work. I just couldn't believe it. Literally every other person. And it's remarkable. It's very important.
It's very important, and it
Yeah.
it gives you just that fire underneath you
Right.
and why you do what you do. I mean,
Right, and sometimes I think it's a shame that doctors need a personal.
Of course it's a shame. Right?
But on some levels, maybe not. I don't know.
Well, I think what it is to break out of the mainstream medicine 9 to 5 employed physician, RVU mold, you have to unfortunately suffer with something or a family member suffers. And you say, wait a minute, screw that, I'm leaving. That's
Yeah.
what
Yeah.
it looked like to me anyhow.
Right.
You go
And that
against the grain.
Yeah, it may be an exaggeration, but it seems that way to me.
Right. Well, I mean, I became interested in hypermobility and connective tissue for personal family reasons as well.
Yeah.
You know, so I guess. Yeah. But I also, it's weird because when I think back, like I don't even know if that was my inciting factor. I just started to see all these patients,
Right.
and they were all hypermobile, and they had similar symptoms that had nothing to necessarily do with joints.
Yeah.
Right. So I was like, what's this about? So I don't know. I think it's a combination. Frankly.
Yeah, it is. I mean, when I say I didn't have anything, I don't have anything. But, when I started out with HIV, not everything
Yeah.
you can find.
Yeah.
I think that set the stage for saying, okay, I'm gonna be dealing with these unknown illnesses and doing crazy things to try to help people back when we didn't know what to do and they're all dying. And that set the stage for a willingness and a sort of the infrastructure to dive into other unknown illnesses
Yeah.
that were not being properly
Right.
addressed.
Yeah.
It changes your perspective enough where like I'm receptive to completely other ideas that are outside of the
Right.
conventional training that we both received for
Right.
sure. And so when I talk to patients, like when I was talking to you, I mean, I was like listening to your every word and your experiences, and I was sort of taking it all in and trying to sort of understand the journey that you've been on, which is so effective for me to sort of know how to insert myself, right? So I think that's what we do. We try to insert ourselves into patients' lives
You
and
become,
figure out how to like,
instead of just the
divert it.
doctor, you're a
Right.
human.
yeah.
And there's a big difference because I've had a lot of doctors listen. And you listen from a human doctor perspective, and it is a little bit different because you're compassionate, but you're also got your doctor ears on.
Right. I mean, and I appreciate you saying that. And I know we're sort of off topic of your story, but like often I think, do you ever feel like an imposter syndrome kind of thing, right? Because we were so indoctrinated,
Yeah.
and that sometimes I'm sitting there thinking like I'm putting dots together that I'm not even so sure should go together, and then I start feeling like, am I just an imposter here? Because this is not what I was taught to do. I wasn't taught to connect these two dots, because I was taught these two dots are so divergent that they have no right to be in the same box, kind of thing.
So I
Right.
agree
So
with
sometimes
you.
I struggle with that.
Yeah.
I still struggle with it, even though I've been doing this for years
So
now.
I agree with that, and there's another version that I worry about, which is I become concerned. Am I always looking for the same explanations for
Yeah.
problems? So
Hammer and nail,
do
right?
hammer and nail. So do I always go back to infection, or I always go back to mast cell? Oh, that's your mast cell, and it's a very dangerous thing.
It
and
is
I
very
try to
dangerous.
constantly monitor my thinking and what I say because of that. So it's very important.
Yeah, and I think that's an important point that we should talk more about it in maybe another episode. But because we are cognizant of that. So then when doctors sort of say things like, "Oh, Dr. Kaufman, Dr. Roy everything is this."
Right.
It is not true. It is not true. We are regularly sort of second guessing ourselves.
Exactly.
I regularly rethink my initial thoughts and go back like, is there something that I'm missing? So yeah, I think it's important for even patients to know that
Yeah.
we don't see we're not a hammer and everything's a nail.
Right.
We do really
It's an easy criticism to try to make.
it is
of
an
us.
easy. It's the low hanging fruit when other doctors want to criticize the kind of work that we do.
And we joke that I hit all the boxes like
Right.
it would be an easy
Right.
map
It's
to
not a
look at and go,
checklist,
oh,
yeah.
yeah, here you go.
Yeah.
It's very
So
difficult.
that's a good segue because I
Yeah.
wanted to bring something else up about your story. And you probably heard me say this on the podcast. So you got a diagnosis in 1998, I think you said. So 25 years ago, which is pretty amazing if you think about it, a chronic fatigue syndrome. And that's a problem to me because what that was, this is a classic, maybe I don't have your story completely, okay, but a classic example of labeling somebody with that diagnosis and saying, okay, done deal. You have chronic fatigue syndrome. There's no treatment. There's no cure. We don't know what causes it. Good luck. Have a good life. I hope you get better, less tired. Whereas our point, and 500-600 other doctors' point is, chronic fatigue syndrome is just a label. It is the common endpoint, a phenotype, and under that phenotype or that endpoint are things like the septed and POTS and mast cell and EDS and hypermobility, infection. And if you stop at the label, that patient's never going to get better.
Yep.
And that's part of what happened to you.
Yeah.
And it's something I feel so strongly about.
No, I feel strongly about it as well. It becomes like this wastebasket, and everything is
Yeah.
just put in there. Like it's all
And
related
I was
to
actually
this.
told it was a wastebasket from
Right,
my
right.
family
That's a
doctor.
a
It's
medical
actually,
term,
he
right.
said, we're looking for everything because this is the wastebasket disease. This
Right.
is what we give you when we don't know.
Right.
We've ruled
And-
everything else out. It's chronic fatigue syndrome. Bye.
But yet they admit they don't know, but yet you bring new symptoms up and it's still thrown in the basket. So that's the frustrating thing as the patient when you're like, oh, there's more symptoms though. I
Right.
think this is
Yeah.
important.
And I don't know how you felt when you heard that diagnosis, but I've had patient after patient after patient say, I was so relieved when they told me I had chronic fatigue syndrome. They didn't just say I was crazy or anxious,
Right.
because at least they felt they were given a diagnosis. And I sit there and I kind of got like, oh God.
Yeah.
'Cause
No.
I know there that then
I
it
know.
stops.
Because especially during that time, that was the only other option.
Right.
You either are crazy or you have chronic fatigue. I mean,
Exactly,
honestly, it wasn't that you had something else physically wrong with you. You either have a mental, because it was so different then. It wasn't all one body. I mean, really, it was you either got a mental problem or a physical
Right.
problem.
Right.
And quite frankly, most people thought I probably had a mental problem, which, yep, I was very depressed. Yep. You know, when you're ill, you don't feel
Sure.
good. One leads to the other.
Yeah. No. Well, we have a podcast that we haven't posted yet that we talked about that. Right. There is clearly a normal reaction to chronic symptoms, and that can be under the realm of anxiety, under the realm of depression,
Yep.
and that is a completely normal response. Why wouldn't someone feel that way?
Right.
Right. But it's not the reason for the symptoms.
Right.
So, and I think that's an important distinction.
Right.
And so many doctors are just willing to say this is depression, this is anxiety, or you have too much stress in your lives, you're perimenopausal. You know, it's women that get all those different diagnoses.
Yeah, it really is. And
Yeah.
and they get, make sure you do counseling and do this and that and the other thing, and which are all good things, but as a patient hearing that that's what you need to do for your physical symptoms, you're kind of like, what?
Yeah.
Okay. Oh,
No, and it is true. And I will say, and I said it on that podcast that we haven't posted yet, but another important point is that when you start feeling better, when you feel like you have better control of your symptoms and your life, the after effect of like those lost years are real. And,
100%.
And many patients will develop then a mood disorder. Let's leave it at that. Dysthymia or just like a feeling of like lost life kind of thing, which is really hard for someone who is now older, right? You get to a certain age where you're like, oh my gosh, I spent so many of my productive years, which I can argue that all years are productive, but being sick. And now that I'm feeling better and have a little bit more of my life, like I'm so sad over the loss of that.
Yes.
And that's a real thing. And I always say to patients, again, usually not the first visit, but once we've gotten to know each other and trust one another, I always say eventually at some point you're going to start feeling better and we're going to have to contend with that. And that's okay. Just have that expectation. So, and I think that's an important, because there's so many people are already told that they're just depressed and anxious and stressed. So it's important to
And
think about it like that.
There is the reality, though, as the patient, and we know this, that we do get depressed and we do get anxious and we do have physical symptoms. And every day is different.
Every day is different.
For
That's right.
everyone, quite frankly, not just people that are ill, right?
sure.
We all
Right.
we all are different, but lining that up with like, okay, so am I so depressed that it's making creating this symptom? I mean, where we like catch ourselves, and I think if I could give some patients some advice, that let a counselor work out your mental problem.
Right.
Just go visit one and go work
Yeah.
that out, because once you talk it out and realize what's really in there about, am I really in my gut? Is what's happening true, or am I making it up because I'm depressed? I mean,
Right.
it's good to talk that out with someone, because we do think it. We think
Yeah.
that maybe this is really in
Because
our
you've
head.
been told it
Mhm.
so many times.
Well, and the other part of that's really important, what you're saying, is that depression or that mood disorder, I prefer saying that, in fact, will cause or have an impact on medical symptoms.
100%.
So it is a two-way street. It's bidirectional.
Yep.
It's not. It's being presented to too many patients as unidirectional, meaning you're depressed. That's what's wrong. You don't have anything wrong with your body. It's your brain and your mood, and that's not correct. You may have some mood disorder, but that mood disorder is likely caused by your illness and your normal appropriate response to illness, and that mood disorder is making the illness worse. Right? And that's why these brain plasticity programs like
Yes.
DNRS and Gupta and
Yep.
have actual, real, solid impact.
Yeah.
I really do.
You know?
Yeah.
I
Yeah.
like those programs a lot.
Yeah, even just all the learning about natural painkillers in your brain and how that works.
Right.
And I mean, it's just all so fascinating. But yeah, you're right. Just trusting, we need to trust our guts, and we just
Yeah.
need to say it how it is and not be afraid.
Yeah, you need to share if new symptoms crop up, and you sort of need to have continued communication with your doctors, because you sort of never know when a particular symptom is going to make your doctor say like, "Oh, that's interesting. What's that about?"
But I'll bet you a lot of patients are similar to me, where when they have to make a doctor appointment or a doctor call or something, the anxiety and the thoughts that
Yeah.
come in, boy, it's just ridiculous. Even if it's not going to be that way, and we're like, it's fine. This is a good doctor. We're okay.
Right.
It's still, there's a lot of trauma that comes from that.
I'm sure.
When you're not
sure.
believed, I think that is probably the most hurtful. Just as a human being, and
Oh, gosh,
and
yeah.
patients, it's hard enough if the doctors are not believing. But when you have, like, I had family members who still some days I
Yeah.
think struggle with that, and you just have to kind of go, well, this is my truth. I can't make it any truer,
Right.
and let that
Right.
be their problem.
Right, and you have a supportive partner.
I have the most supportive
And
partner.
I haven't
He's
met
so
them,
good.
but great
Yes,
kids and
100
9
yes.
grandkids. And
Oh, I have.
so I think
the best
yeah,
life,
So you have a
so-
really good network, and and I think a lot of patients don't have as strong of a network as you do
Yeah.
in terms of family support, at least in their immediate family.
Yep.
And I have found that does affect like how their mental health is, frankly, because I think those that are immediately around them don't believe them either.
And what's really cool, and I don't know how to, I think if I say this, patients will understand, they let me be or seem healthy. And I mean that because sometimes we feel like we're being watched,
Yeah.
or we feel like we're being judged, or here I'm on the ground and I'm rolling around, I'm playing with my grandkids and I'm all over the place, and it's going to hurt like crazy tomorrow.
Yeah.
But that's my choice. My choice is to be on the ground and doing that. That's how I want to spend my energy.
Right.
We all have so much to do with
No,
what we
absolutely.
choose. And I'm just so grateful that they allow me to do that, and I don't have to sit there and feel like, I wonder what she's thinking, you
Yeah.
know.
No,
'Cause
exactly.
I'm-
You feel comfortable to
I've-
just sort of be you
Yeah.
on any given
And I get to
day.
be
Yeah.
110% if I want that day, and then I can go home the next, or,
Right.
or I just get to be, who
It's
I am.
the spoon.
Well,
it's the
that's
spoon theory that
It is,
patients
yeah.
often talk about, right?
For sure.
How you use your spoons.
Yeah.
So I think that's an interesting way.
And
to-
I choose to use them, and I've always used them. Maybe faking it is a word, but that's who I am. I can't. It's very weird when you get it. You almost are two different people when you're sick, because
Yeah.
you're the person that walks out the door and greets people, and then at home you're kind of a different person.
Yeah, absolutely.
But I still want to be that person. And some people, I think, feel that they get stuck as the patient, and in order to get help from doctors or from friends or from anybody, they have to stay just the patient.
That is very true.
And
that is a
I
very
think-
nice way of putting it.
I think that if you stay just the patient, you will become very, very depressed and very anxious and very uptight, and you will just not have a fun life, as I've done
Right.
this. I
Right.
speak from experience.
I do think, though, I think we should obviously make a point that some people don't really have any spoons, right?
No,
we have lots
exactly.
of patients who are
Exactly.
bedbound and
But use your spoons how you want.
right.
And if you want to go out and you want to get dressed up and go out on the town, go for it. Use them the way you want, instead of sometimes we sit there and go, well, how are people going to think are they going to think if we're out to dinner, they're going to see us, and we didn't go to church, or we didn't do this, or we didn't do what we had to do or something.
Or if you can go out to dinner, how can you be sick?
How can
Right,
you be sick?
exactly.
Right. And it's like, because that's what I choose to
Right.
do. And
Yeah, and
I
I
may
always
be
say
in bed
you
for
don't
2
really know
days.
what goes on in people's lives. You don't. If I saw you in a restaurant, I would never know. I would wouldn't assume that you wake up at 3 a.m. with a headache.
No.
You know, that you have to sit up to get rid of it, and
Right.
you know, or that you have
That
so
I
much
drink
pain.
a Coke every day.
Right,
to
exactly.
Get rid of my
Or
headache.
that you fatigue. Exactly. I mean, it's true. Like, you just don't know
Yeah.
about other people's lives, and so to make any kind of judgment or presumption just because you see someone somewhere is just so wrong.
Yeah.
And I think, especially these days when so much social media, where like, everyone's putting their lives out there,
Right.
everyone's just sort of making judgments, and it's such a dangerous thing to do. It
It
really
is.
is. We just don't.
we
We
all
don't know
have our
people's
stuff.
stories. Yeah,
We do.
It's so true. It is so true.
And as
So-
patients have a lot on, that can be seen and be kind of evaluated, but we all do have things, and
Yeah.
and we get to choose how we live our lives.
That's right.
So
So another important aspect of your story
yeah,
that I want to point out to people is the role, and you can obviously amplify since it's your story, the role that your personal research played, and your, I presume, use of the internet and books to potentially try to learn what might be wrong, so you could then pursue those avenues and bring some of those facts to doctors if maybe they would listen. And I mean, I think it is so important. The fact that we have the internet has made so much available to people. And it's a double-edged sword, okay? I mean, there's people with your story where they kind of figure out, oh, I have the septet, or I have MCAS, or I have POTS. I just read these articles and I watch these crazy doctors on the podcast, you know? And then there's the flip side, or the other edge of the side of the coin. What did I say? Double-edged sword. The sword
Other side of the coin, double-edged sword.
use them both.
is over listening to not such accurate information
Correct.
that sometimes occurs in the forums, in the chat rooms. And
Right.
sometimes it's just out there. Sometimes it's some male or female with some glitzy podcast that says, "Oh, you'll be better if you just drink this water that has vanilla in it," you know. And it's hard to sort out. But at the end of the day, the internet as a source of knowledge for people like you is beyond belief. And I would say for me too, and for physicians. I think every single day I have a moment when I say, how did I do HIV medicine without the internet? Because I'll be on the internet looking things up 50 times a day.
Yeah.
Yeah.
I mean, I don't know everything, and I have to look it up, or I forget something. Sometimes I'll forget the name of a drug,
Yeah.
and I'll put in drug for, because I have it
Yeah.
easy, and it'll come right up.
Come
Yep.
right up.
You
I
know?
know.
Oh, I'm the same way. I use the internet all the time, but I think really important, we have to know where the information's coming from.
Exactly.
Yeah.
Exactly.
Right,
That's
the
really.
source.
You have to-
I only have a few sources as far as like I don't just trust anybody, right?
And you have to realize in the I don't do any of the social media, but in the Facebook social media stuff, the negative information, let me think, I don't want to say this. It's more likely that people with negative outcomes will be commenting than positive. And I'm speaking specifically of the CCI stuff and Dr. Bolognese and all the stuff, to the point where I just tell patients, look, if you want to believe that, that's fine. That's not my experience as a referring physician. It's not Dr. Ruha's experience. And I believe that mostly people who have negative problems, they're the ones who speak up.
Agreed. I think that a lot of support group, social media groups are centered more around just the complaints of being ill rather than trying to solve problems or getting to the next step.
Right.
So I would be, even when I was doing coaching, I'd say just stay away from those unless they're a positive, like unless they're giving you something, unless you're learning something or that's spurring you on to find something else, right? But don't just listen to just any old.
Yes, and I don't mean to say people don't have the right to complain or say I went and had a
Yes,
terrible
but
surgery.
no,
They
that's
definitely
what
have a
they
right to
are.
complain.
Yeah.
We do it all the time.
No, I know. but I don't mean to say they can't be public about it. But
Yeah.
but as a listener
Yeah.
or a patient or a researcher, just keep in mind that those numbers, those are not representative statistics of outcome.
Right.
Correct. Those are just opinions.
Yeah, they're just that's true. They're opinions.
They're just opinions, and
And,
we
and
all
maybe maybe it truly is based on their experience, but it still is just one person.
yeah.
So.
No, I think it's always good to kind of to say, okay, yep, that's their experience, and maybe you want to learn a little bit more about what some people went through, but. A lot of that is the one, what is it, the squeaky wheel? It's the person that had something wrong that's on there.
And the reason it's impactful and the reason it's a concern to me, and I'm pointing it out, is the denominator in that group is the same as the numerator, okay? So there may be 44 people complaining, but there's not another 100 saying good things because they're
Right.
just not up there posting.
Right.
So it
Right.
looks like, to somebody who doesn't know about this, a patient or a family person or whatever, looks like, oh, everybody who goes and gets that done has a problem.
Right. Right.
And it's in context is very important.
No, it is because people will bring it up to us, and then
Oh,
we
yeah.
spend time trying to combat that
Yes.
and get to the core root of. So, what exactly is your concern? What exactly is your fear? Let's
What
address
did you
that.
hear? is
Right. What did
what did you
someone
read?
tell you?
What did someone tell
I
you?
said to my kid when she was little, "What did that person say to you in the play yard?" Well,
That's cute.
well, thank you so much for joining us. This was
Thanks
a
for
really
having
great
me.
conversation,
I've
and
loved
I
it.
think I know most of our subscribers are patients, so I know for a fact that they will have enjoyed hearing your story, and we really are grateful that you agreed to
Yeah.
come on and
been great.
and share.
Thank
Also
you.
courageous because it's after only one visit with Dr. Ruho. That's pretty gutsy.
Yeah, but I have listened
What
to
does
every
that mean? She
She
podcast.
hasn't really established a full
Right, you haven't yet gotten like the full Ruhoy.
You haven't gotten the
But-
Ruhoy, no, you know.
But if you were at your house and you listened to each one of these podcasts, you would be surprised at how well you feel. I mean, I feel like I know you. I feel like I get your humor. So I mean,
And you're not even a New Yorker.
just gonna
see, I'm my own breed, though. I had a doctor say that.
That
He
you
says,
were
"You
on breed?
autoimmune. You do have an autoimmune disease, but we can't name it. Undifferentiated." He says, "So we'll just call it the Julie disease. It's just your own."
Right.
I thought, "Oh, I'm really rare." And no, I found you guys, and I'm not. Thank goodness. Thank you for all the work you
thank you
both
Oh,
do.
you're very, very welcome. We enjoy doing the work we do for sure. And we plan on continuing to do it as long as people will listen to us.
Right.
Well, there's
eventually,
one.
eventually they're going to get tired of hearing us.
As long as you got one, then you're okay.
Well, again, thank you so much. And I know
Thank
that you
you.
made a long trip here because while you live in the state, it's not around the corner. So we appreciate also the travel. We're trying very hard not to do Zoom. I think I told you this, not to do Zoom because I really like the energy of having people, in the room. And I know that you agree. And
Yeah,
so
for sure.
we do appreciate you taking the drive.
Anytime.
All right.
You want me back? I'll be here. This
Okay.
is great. Thank you.
You might have to regret those words. Okay.
I'm for it. I'm for it.
Well, thanks again for joining us.